the raging spread of HIV infection in the children and adolescents of Irkutsk District of Siberia. The official theme of the 18th International AIDS Conference in Vienna during July 2010 was the need to attack a growing epidemic among drug addicts in Eastern Europe, Russia, and Asia. Here's what New York Times writes about it. Everyone was worried that the war on AIDS is falling apart, since outside of Africa, almost a third of all HIV infections stem from drug injections. However, the estimation pales compared to that of Siberian district of Irkutsk, where in 2009, almost 40% of infections were drug-related, down from a staggering 95% 3 years earlier. Despite government fundings and international medical research and social programs, the Siberian epidemic is still so overwhelming that compassionate couples who can fortunately afford to have in many cases adopted newborns and children, knowing full that they have no chance to survive. The Irkutsk district has the highest cases of HIV infection. According to the district's AIDS Prevention Center, as of January 1st, 2010, the cumulative number of infected individuals for the district was 28,786. The attack rate from 2003 through 2009 increasing from over 600 to 1,100 per 100,000. Since there was 16% increase of HIV infections in 2009, in accordance with World Health Organization criteria, the Irkutsk district is in the generalized stages of the epidemic. Men predominate the structure of HIV infection at the beginning of the epidemic, the overwhelming majority of whom were users of injected drugs. Starting in 2003, the ratio of men and women in structure of HIV-infected individuals gradually equalized. By 2009, there was 46% of women among infected individuals. This high percentage aroused alarm, since it occurred primarily among the most reproductively active age, from 18 to 29 years. Consequently, it was noted an increase in HIV-infected pregnant women, which led to increase in the number of infants with parietal contact with HIV. As of January 1st, 2010, a running total over 4,300 children were born to HIV-infected women, as recorded in the Irkutsk district. The birth rate of children of HIV-positive women from 1999 through 2009 increased from 0.5% to 3.5% of all children born during that period in the Irkutsk district. Here is the graph that shows change over time in the distribution of HIV-infected individuals by gender in the Irkutsk district. I want to add to this that the greatest number of HIV infection women falls in the 20-24 years age group. The next graph shows change over the time in the birth of children of HIV-positive women in the Irkutsk district. The birth rate of children born of HIV-infected women in the district has steadily increased, and at the end of 2001 exceeded 1% of all deliveries. While 29 children with perinatal contact with HIV infection were born in 1999, the total number of those born of HIV-positive mothers was 315 in 2002. In 1 year, 2009, 733 children were born to HIV-positive mothers. In 2001, the number of interrupted pregnancy decreased among HIV-infected pregnant women from over 64% to 15% in 2006, while the number of the births increased from almost 36% to 84%, respectively. Perhaps this situation is due to the fact that socially adapted group of women had been caught up in the HIV infection epidemic process. Their pregnancy and the birth of their children increasingly became planned decision. A scrupulous analysis of medical documentation reveals the following principal impediments to the implementation of chemical prophylaxis of perinatal transmission. Number 1, mothers refuses to carry out the prophylaxis. Number 2, disruption of drug dose. Number 3, a late diagnosis of HIV infection. Number 4, entering maternity homes without an evaluation including HIV testing. Number 5, concealment by women of their HIV status. The distribution by years of adolescence among HIV-infected individuals is uneven. The largest number among this group was recorded during 1992-2002, primarily represented 15 to 17 years olds actively using psychoactive substances. The distribution of adolescents by gender composition during the period of 1999 through 2001 indicated that overwhelming majority were boys. Starting in 2002 until the present, the number of boys and girls among HIV-infected adolescents has been approximately equal. The rate of HIV infections in different age groups of children and adolescents is uneven, though those from 15 to 17 years make up the largest group. They are most active sexually and in the use of psychoactive substances. The group of adolescents is often vagrant without a permanent residence. And here the graph shows distribution of children and adolescents by gender composition among newly diagnosed cases of HIV infection. The proportion of children and adolescents in the structure of HIV-infected individuals is gradually diminishing due to a reduction in drug-related route of transmission. But at the same time, the number of children in whom the vertical transmission is operated increased from 5 in 2001 to 34 in 2004, and this figure was 42 in 2006. The next graph shows you the structure of clinical stages of HIV infection in children and adolescents of the Irkutsk District. Let me explain the numbers on this graph. This classification is done according to Russian classification of HIV infection. 4A stands for signs and symptoms that include weight loss less than 10%, bacterial, fungal, and bacterial lesions of the skin, mucous membranes, outbreaks of herpes zoster, recurrent pharyngitis, sinusitis. The number 4B represents weight loss more than 10%, unexplained diarrhea or fever lasting more than 1 month, recurrent persistent viral, bacterial, fungal, or protozoal pathology of the internal organs, recurrent or disseminated herpes zoster, localized corposis sarcoma. 4C represent generalized bacterial, viral, mycobacterial, fungal and parasitic diseases, including pneumocystis, pneumonia, esophageal, bronchial, tracheal, and pulmonary candidiasis, extrapulmonary tuberculosis, atypical mycobacteriosis, malignant tumors, lesions of the central nervous system of different etiology, and number 5 represent the terminal stage of the disease. The fact that many HIV-infected children are not under care of parental under care of parents represents a serious problem. This occurs primarily as a result of the refusal of mothers and other relatives to raise them when they are born. Rarely are the children orphaned due to death of the parents. 294 rejected children born of HIV-infected mothers were registered in the district as of January 1st, 2007. The most common reasons for abandonment in Irkutsk city are unintentional pregnancy and mother's drug use. Of the 180 children registered with Irkutsk Health Center, 124 were under observation because of contact with HIV in the perinatal period. 56 had an established diagnosis of HIV infection. 9 of these and 6 children with contact to HIV and perinatal period have been placed in custodial care. Thus, the HIV infection epidemiological situation of the Irkutsk district is very strained and poses a whole new series of the new tasks for public health and medical service with the spread of the infection from the million of users of narcotic substances of other population groups, including children. Among nearly 1% of the adult Russian population is HIV infected. No one from the governmental health officials attended the 18th International AIDS Conference in Vienna. Nor will the government allow the needle exchange or the methadone type of treatment as the epidemic continues to range in the Irkutsk district of Siberia. Here is what Alexei Mazus said in an interview to a Science magazine. By the way, he is the head of the Moscow Center of HIV/AIDS Prevention and Treatment. It is not there, he means other countries, business, what is going on in the Russian Federation. On this, I want to conclude. I want to finish with my presentation. Thank you for your attention.